I'm here with Professor Kuhle. He's head of the multiple sclerosis clinics in Basel, Switzerland. Jens, you gave us a wonderful talk yesterday on the Hot Topics plenary session about neurofilaments and multiple sclerosis. Can you tell us, for all of us who are not so familiar with neurofilaments, what is a neurofilament?
Thanks a lot, Lutz. So the neurofilaments are neuron-specific proteins. They are highly specific for the neuroaxonal compartment. They are not specific for any disease, but they can be used basically to quantify the health of the neurons in the body, be them coming from the central nervous system or also the peripheral nervous system.
Okay, thank you. Especially in MS, what can neurofilaments help us in monitoring the disease or look after effects of the therapy?
So in MS, especially in relapsing remitting MS, we have actually approximately 10 to 15 approved drugs. And in daily clinical practice, while counseling our patients, we do struggle from quantifying the treatment effect in individual patients. So the hope really is here to have an easy, accessible, blood-derived biomarker for treatment efficacy that we could, for example, sample every 3 months or every 2 months and then maybe draw conclusions on escalating or switching drugs in relapsing remitting MS. In progressive MS, there is some hope that these biomarkers like neurofilament could potentially reduce the noise and increase the efficacy for trial outcomes really, and to facilitate the detection of new drugs for progressive MS patients.
Okay. Mm-hmm. And is it also a prognostic marker maybe?
So this has been studied quite extensively over the last months, and indeed we see that patients with higher levels of neurofilaments also have more relapses, have especially more brain atrophy over the next 2 or also 5 years. And even with the difficult outcome of EDSS worsening, we see some predictive relevance for worsening over the next 1 year. But also on the longer run, in the pivotal fingolimod trials, we've seen some long-term prognostic relevance, and also in the pivotal trial for interferon beta 1A, we saw these effects, yes.
Okay. And is it only an MS-specific marker, or is it a broader field in neurology?
So that the marker is specific for neurons. It is not specific for disease, so it's not really a diagnostic marker, but it's more a measure of neuroaxonal health in all kinds of neurodegenerative diseases, like for example also ALS or Huntington disease, also the dementias. Neurofilament will and has already some position as a trial outcome, for example, in diseases that may not have so many treatments available as multiple sclerosis. This could be a potentially promising trial outcome also.
Okay. Thank you very much for this.
Thank you. Thanks a lot.
Thank you.